Healing Goals, and every conversation brings us closer to a healthy mind. And today I have my special guest. He's a writer, a business owner, advocate, sensory friendly event specialist, none other than Mr. Thomas R. Wilson.
Hi.
Welcome back, Mr. Thomas. I hope you will be my regular guest on Mental Health 101 and let's empower people all over the world through their mental health awareness. And can you please introduce more about yourself that I missed?
Absolutely. So I am, like I said, I'm a business owner. I'm an advocate, writer, storyteller, sensory-friendly event specialist, so much more and more. Um, but at the same time, I am also a member of the mental health community, both as someone seeking care, but also as someone providing care. I have lived with my own mental health diagnosis since I was 8 years old. But I'm also a strong believer in the power of creativity to build communities, to build sustainability, and to also help people all around the world better understand who they are and who they want to be.
Better understanding, and thank you so much for sharing your knowledge and wisdom to the world, Mr. Thomas. And today let's talk about how can we build up the mental health community. So, Mr. Thomas, we can talk about the mental health community. It can mean many things from
Mhm.
professionals and researchers to advocates and those who live experience. In your view, who is included in that community and what is the current state of its overall health?
So I love that question. So I think really the mental health community, like you said, it can be a vast array of people. It can be providers, it can be family members, it can be with people with in lived experience as subject matter experts. But I think it's also important to note that a mental health community can be just about anyone who is seeking or is advocating for their own wellness. I think sometimes the mental health community can be a little exclusionary. I know a lot of people right now prefer it to have be someone with a diagnosis. But I think at its core, anyone who is seeking mental health, like a more positive mental health state, is valid and worthy to be in that community. And I think it's also important to note um, mental health and mental health diagnosis are very different things. Um, Having a diagnosis, yes, it can be challenging, yes, it can be stressful, but it gives us a pathway forward. But it's also important to note that there are so many people around the world who are advocating for their wellness, whether or not they have bipolar disorder or anxiety or anything like that. And so I think we should include all people who want to live their best mental health life. And I think, especially in the current state of mental health care, there is a discussion on that. There is a discourse on who counts and who doesn't. And I think it's best not to exclude people because that's also how we find out. Like self-diagnosis or the self studying journey can be a very valuable pathway to the future of our own mental illness as long as we have appropriate help from doctors. The last thing I want to say on the state of things is I do have a lot of faith for the state of current mental health communities. We are more accepting, more kind, more passionate about global mental health than we ever have been as a species. And because of that, I think we're in a very positive direction. Now, there's a lot going on in the world that is fighting against that, but I think when we have conversations like this, when we start to discuss the value of mental health communities, that's where some of that stigma and bias dissipates.
Hmm. Biases. Well, you you made a huge strides in awareness, Mr. Thomas, but awareness has not necessarily translated into accessible care or reduce stigma for everyone. Where do you see the biggest gap between the conversation about mental health and reality on the ground?
So I love that question as well. So I think the biggest thing between the conversation and actual accessibility is the reality of healthcare, unfortunately. Um, there are a lot of people in this world who, and I hate to say this, but don't have access to good doctors. They don't have access to their community. They don't have access to the world. We tend to forget that there are a lot of people who don't drive, who for very valid reasons. We tend to forget that in this modern age of technology, there are people who don't have good Wi-Fi. They don't have a lot of different access to things a lot of people do. And I think when we talk about the mental health care community, we it's so easy to forget about those people. It's so easy to step back and think about the success stories or think about where we need to grow because human beings are very good at forgetting about people. And I think that's the biggest issue between the conversation and the translation is there's still not enough community voices. There's still not enough doctors or nurses properly trained. And I want to say doctors and nurses work hard. I actually am a big advocate that we have more about how hard it is and how much work nurses have to do. But even just peer specialists and things, it's so easy to forget about the people who are not in the facility in those moments. The other side of it, I think, is also we as people, um, I think as a species, honestly, we all have a touch of out of sight, out of mind. I know here in the United States, we don't always think about the people like in Africa or in other continents that don't have the same level of care. Um, and so, in that, it's still an accessibility thing, but I think we also forget that mental health care looks differently for people all over the world. Um, it looks differently for people all over the world. It looks differently depending on the community. And so I think one of the biggest things when we talk about accessibility to the actual implementation of that is we have to acknowledge that there shouldn't be just one pathway for mental health care. There should be many, and it should match the people that we work with consistently and constantly. And if that looks like accepting a different perspective on faith or religion, or if that looks like accepting that there are people who may have to walk several miles to get somewhere, or may not have a safe mode of transportation, those are all crucial things. And so I think it really does have to become more of a discussion on how can we match people person to person and then how we can better implement accessibility.
Better implementation, indeed. Access to care is still a massive privilege, Mr. Thomas, for someone in a rural area or marginalized community, or even just as someone without great insurance. The system is often impossible to navigate. What are the most innovative or effective solutions you have seen that are actually bridging this access gap?
My goodness, you have you always have fantastic questions. Um so yes, I do want to highlight unfortunately there is a real reality about privilege.
Mm,
Unfortunately, actually getting access to healthcare can in and of itself be privilege because there are so many people, like you said, in rural communities or heavily marginalized communities, or there's other biases culturally that can impact things. And I think that's very important to note. It bothers me that that's a reality, but I think the biggest innovations, and I like to say that I'm part of this, is I think there are more and more people who are acknowledging that, and they're starting to implement community programs more and more that can be brought to rural communities. They can help people develop things like their resilience, their problem solving. I myself, I do Dungeons and Dragons and storytelling events to help people develop real life skills. I think there's also a really big move, especially in my state, for rural community grants to be implemented. In Colorado, we have a lot of very rural communities that don't have often have access to things. And luckily, my state is constantly in creative idea grants, which is huge to serve people in those communities. It's getting a lot of money out there to help people, and it's also encouraging organizations to go beyond. But I think one of my favorite things that I have seen is there's also a lot of people within the community who are taking it upon themselves to be educated, and they're going out and finding ways to be creative, even if it's not storytelling or painting. It's let's get together, let's create our community, and let's do this within our space. And I think that is in the heart of community advocacy. That is the heart of mental health care in general. If something does not access us, we step up, we make it a reality. And that is happening across the country, especially with like Gen Alpha, Gen Z. There's such a huge movement for that. The other huge thing that I've seen is also there are more and more families putting together um, family support groups that also have active play for kiddos during that time. So while there is this a large darkness going on, there is also a huge movement and a hugely passionate cry that is leading to some very innovative and very fun programs out there.
Very well said, Mr. Thomas. And let's talk about the workforce. Therapies, psychiatries, social workers is burning out at the alarming rates. How can we build up a community by better supporting the very people who are supposed to be the supports? What does caregiver care look like in this field?
So I want to emphasize really quickly because that's another great question. Caregiver support is not something that is talked about enough, especially within organizations all across the country. You are absolutely right. People are burning out. We're not getting supports. Unfortunately, there is a big cry against doctors and nurses and healthcare in general. And some of it I can appreciate. Some of it, the healthcare system, especially in the United States, is very broken, but it's broken in a lot of places around the world. And unfortunately, the medical model is kind of being seen as one of its biggest flaws is it's not treating people as people. It tends to treat them as their diagnosis, and that can be very hard. But at the same time, there's less and less support for those providing care. There's this anger, this hostility is creating very toxic cultures in and out of the workplace. There's actually alarming statistics on violence against nurses and doctors. But I think the heart of it, and I think the easiest way for us as people to support caregivers, to support therapists and doctors and nurses and other providers, because this is so crucial, is to apply empathy and apply grace to our providers. I think so many of us have been taught inherently to fight to survive, but not everything needs to be a fight in order to survive. At the same level, I think, especially like family caregivers or those within the community who are also serving someone they love with a diagnosis, but they're also out there doing the work, which is so many of us. We have to create better community supports. We've got to have respite for these individuals. We've got to have compassionate spaces for them to share their worries without judgment. And I think as us as a community, we have to kind of go back to the discussion around how hard it is to be a mental health care worker and to deal with things like being in hospitals and all of these things. Because it's, yes, people have messed up, but it doesn't mean that we can't change as providers. And the last thing I really want to emphasize, and this is one of the biggest things, I think we really need to break down this cultural bias against healthcare workers and kind of look at what may be causing that. Because, yes, there's so much hostility. But I think it's also forgotten that so often, even the best doctors and nurses and therapists, just like the best teachers, they're working in a system that is a constant uphill battle. And because of that, they're showing up on their worst days. They're showing up tired, worn out, probably traumatized, depending on how bad the day is. And they're still trying to help people. And I think having that discussion among the others that I've had is so key to supporting these caregivers.
Again, very well said. Mr. Thomas, how about the peer support and community based programs are often undervalued compared to clinical care? What the role do these informal networks play in building up the community, and how can we better resource and integrate them, Mr. Thomas?
So another great question. And that is true. I will say peer support is growing.
Mm,
And its value around the world. It's still so new, and I think that's part of the thing that really hinders it. But it is a valid and sustainable way to maintain and seek new methods of healthcare. Going off of our last question, like a lot of people don't want to go to therapists or psychologists or psychiatrists because they have a negative experience with mental health care. And it's so hard to, like, there are so many great therapists and psychiatrists and psychologists out there, but matching to the right person is so hard. And I think that's where like peer support comes in, because it's less the medical model and more the peer model. And I think a lot of people don't even know what that is yet. And I think that's its big weakness. But I think to implement it, again, this, I'm huge on communication. We need to have conversations within the community of value of having a live subject matter expert guide someone in their mental health care, especially if people don't know. It's less a position of authority and more collaborative exercise towards mental wellness. And there are other programs out there. I will say, again, people are shifting towards these at a rapid degree, but in systems of care, in our communities, lack of knowledge is one thing, but there is a lot of bias, and the differences in training creates a lot of hostility. But I think the first step is acknowledging the value. I think if you have a peer specialist that you love and has been really important, I recommend talking about that. I think for those of us like myself who have peer specialist background, we need to continue to advocate for the work that we do. And yes, it doesn't always get as much funding. And yes, we have a harder time getting grants. And yes, there is a lot of hostility that people can have towards us. But the final thing I want to say in that is that we as communities should really step up and inform ourselves. We can talk to, if we know what it is, we can talk to legislators. If we're not in the United States, we can kind of explore and have discussions around the differences in this healthcare. And for those of us seeking care to kind of help break that stigma and those limitations, we can, reach out to organizations. We can help empower this work because so much of it is peer based. And because of that, it is community rooted, and the community stepping up and supporting the system of care is really what's going to solidify it as valuable.
Valuable indeed. So, what does a mentally healthy school look like to you, Mr. Thomas? Beyond hiring more counselors, what systemic change in education you fundamentally change the mental health trajectory for the next generation?
My goodness, there is so much I could say on this. But I'm going to try to narrow it down as best I can. I think especially in schools, and I'm an educator. I work really hard. I know how hard it is to be a teacher, especially when you have numerous classes, you're having a hard week. My goodness, do we need to respect teachers more? But I think really one of the biggest faults in education is it's not a super collaborative process. A lot of schools, students are told what to do, they're yelled at, they're disrespected, they're dealing with life, they're dealing with everything going on in the world, given tests, given all of these immense pressures, and then blamed because the system is failing them. And I think a key part of this is shifting school to a collaborative process. And I've seen schools implement peer specialists and social workers. I've seen schools have conversations around mental health. And I've had seen schools really push towards having peers being counselors. But I think the big issue in schools, and I think this is a big issue in educational mental health care in general, is so much of it is fear based and so much of it is punitive. And I think we're not meeting kids where they actually are. We're meeting them kind of halfway in a very like, we have the information, so we're going to tell you how to do this. And I think a school that becomes more collaborative and acknowledges not every student's going to be a success in mental health, but is forgiving and has compassionate social workers or peer specialists, understand and also understands that being a student is hard. It's, I don't know if it's necessarily harder than it's ever been. I like to believe it is, especially I think maybe in the last 80 years it might be harder. There's so much students have gone through in the last span of humanity. But I think we really need to create a collaborative discussion. We need to understand and acknowledge that students are going to share things that we might not have thought of. And I think we really need to meet students where they're at and how they actually learn in their mental health care. But I think what we also really need to do is we need to radically change the school system and change the conversation on how we educate people, change how we grade things, change how we look at students in general. And as teachers, educators, family members, I think we need to acknowledge that there is this shifting weight that previous values are not going to be mattered as much, but also shift the weight from blaming students for failing, blaming them for being upset, and create a more empathetic, loving, and compassionate space.
Thomas, before we wrap up our discussion for today, I'm inviting you to please do listen to my other podcast, people. My other podcast, because my abstract essay is already in sixth season, abstract poetry in third season, and my book 101 review in sixth season too. Comedy 101 fourth season, and my food 101 in sixth season as well. Geography 101 love letters, movie 101 review, music 101 our fifth season, and science 101, sex 101 in its fourth season, and of course, my baby podcast, Trivia 101, Spiritual Awakening 101, Entrepreneurship 101, Law 101, Mental Health 101, Comedy, Coaching 101, and of course, my Bible Verses 101 are my baby podcasts. Please listen to them wherever you listen your podcast. So, Mr. Thomas, finally, if you could leave our audience with one core message, not about problems, but about the profound possibility of what can build together, what would you want them to carry with them?
So I think the first thing is care for yourself. The world is so stressful. It's so chaotic. The level of communication we have and the news and everything is so overwhelming. So please care for yourself. But I think also in general, when we care for ourselves, I encourage you to be brave enough to carry hope and resilient enough to hold on to that. This world is scary, it's dark from time to time, but I can guarantee you there is so much beauty and value and love and growth and happiness that happens every day. And while it might feel like a lot and too much, I can guarantee you it's not as dark as it seems. It's not as hateful as it seems. And there are so many people who want humanity to do well, and maintaining that mentality, carrying that hope, holding on to that hope, starts with preserving our mental health.
Definitely, let's preserve our mental health, people. Mr. Thomas R. Wilson, thank you so much for sharing your knowledge and wisdom to the world once again. So, can you please invite our listeners to support your advocacy, your projects, or anything you want to promote on Mental Health 101?
Yes, absolutely, I can. So you're always welcome to email me at ndttrpg@gmail.com. I know that sounds like a lot of really similar letters, so I'll make sure that's provided in the bottom. You'll also see my link tree and my website, RNH Creative Advocacy and Storytelling.net. Again, did not realize how long that would be. But also make sure my link tree is in there so you can see all of my new projects. And if you're in the Colorado area, or if you just have questions and you're not, feel free to contact me. Feel free to reach out, because I am always a big fan of questions and I am always excited to answer them. And even if you're not with that, I do encourage you to reach out. I love to collaborate with people, and I love to find new ways to help the community, even on a global way.
Yes, people, let's connect with Mr. Thomas R. Wilson, because if you connect with him, for sure, more and more empowering advocacy like this to rise. So, Mr. Thomas, thank you so much for your time.
Thank you.
More to come, people. See